Okay, so how the heart is working and how the heart can pumping the blood throughout the body. So basically, before we starting explain how the heart can pumping the blood, we should know the component or the major parts of the heart. Basically, we have four chambers of the heart. This is the first one, which is called the right atrium, left atrium, and basically they are located above. And we have the ventricles, the right ventricle and left ventricles, which is located below the atrium. After that, we have also the arteries and the veins. So we have here a vein, it's called the superior vena cava, and the same vein, but it's located below it, it's called the inferior vena cava. Okay, so this is the vena cava, yeah, the vena cava, the vein. But why it's called the superior and this one called the inferior? So the inferior and superior, it refers to the what? The word superior, it refers to the which is something located above, so it's located the word above. And we have the inferior, which is located below. Okay, but basically it's the same vein. Also, we have here artery, it's called the aorta, which is the largest artery in the body. And also here we have the pulmonary artery. Basically, pulmonary, it refers to the lung, and we have the pulmonary vein. Also here we have not only the chambers and the arteries and the veins, we have also something called the valve. So here we have a valve which is called the tricuspid valve. Here we have the pulmonary valve, here we have the aortic valve, and we have the mitral valve. Basically the valve which is giving us the normal sound of the heart. So as we know, the normal sound of the heart is called lub dub. Lub dub. This is the normal sound of the heart. And when this valve, when the blood is for example move from the above to the below and something like that, it will giving us this sound because the valve it's closed. So when the valve is closed, it's giving us the sound which is called the normal sound of the heart, the lub dub. And basically after a few minutes we will explain the process how the blood can move. Also, I want to talk about the location. So this one, it's the right side of the heart, and this one is left side of the heart. What is the differences between the right side and the left side? The right side, basically, here we can see the blood which is deoxygenated blood. What does it mean, deoxygenated blood? Basically the blood here, when the blood is moved, it moves from the organs, from our organs, okay, throughout the vena cava. And this blood is deoxygenated, it does not contain oxygen. But the blood which is in the left side of the heart, it oxygenated blood, it's containing the oxygen. And now we will know how this process will happen. So now we will talk about the physiology of the heart, or how the heart can pumping the blood. Okay, so firstly, the blood, it's coming from our organs. For example, from the inferior vena cava, the blood is entered to the inferior vena cava, okay? But basically, which organ here? We have the organs which is located in the abdomen, and for example, in the digestive system, the organs in the digestive system, or for example the legs, all this blood come throughout the inferior vena cava. And also we have the superior vena cava, also the blood is enter throughout the superior vena cava. And the organs, basically, like for example the blood coming from the neck, from the head, from the thorax for example, and they are entered to the superior vena cava and inferior vena cava. Here, as we know, we have here the opening of the vena cava. Then the blood will enter to the first chamber, and this chamber called the right atrium. So basically the blood will enter to the right atrium, and normally the tricuspid valve will open and the blood will move into the right ventricles. So the blood will enter to the right ventricle. And what will happen after that? So now we have the blood move from the right atrium and it's entered to the right ventricle throughout the tricuspid valve. Now the blood will move through the pulmonary valve. This pulmonary valve will open, and the blood move through the pulmonary artery. And as I mentioned before, the pulmonary refers to the lung, so the blood will move to the lung. But why this blood will move to the lung? Because here we have a process called the gas exchange, and the gas exchange will happen in the last part of the lung. It's called the alveoli. So here we have like alveoli, and the process of the gas exchange will happen. Now we will have oxygenated blood, because the oxygen, the lung will give us the oxygenated blood and will remove the carbon dioxide, okay? And this process will happen in the alveoli, in the last part of the lung. Then what will happen? After that, the blood will move from the lung into the pulmonary vein, will enter again the right side of the heart. It will enter to the, the left side, sorry, the left side of the heart. So it will enter to the left atrium, and here we have the mitral valve. The mitral valve will open, and the blood will move into the left ventricle here. So now after that, the blood will move throughout the aortic valve, and the blood will move throughout the aorta, which is the large artery, and it will move into the organs, our organs. It will move to the cells, it will move to the tissues, and the cells can working well, and our organs, it will working. So this is basically to sum up everything. The blood will move throughout the superior vena cava, inferior vena cava. It will come from our organs, and then it will enter to the superior vena cava and inferior vena cava, move throughout the right atrium, right ventricles, then go to the pulmonary artery, and then go to the lung. Gas exchange, it will happen. Then throughout the pulmonary vein, it will go to the left atrium, the left side of the heart, then move to the left ventricle, and then throughout the aortic valve, it will move throughout the aorta into our organs, and then our organs will working well, because we have oxygenated blood. Our cells can working well,